it's Wellness Wednesday. Dr. Amber here with Voitenko Wellness. I'm coming on today to talk about what I spoke about last week in regards to low back pain. I wanted to talk a little bit about what can cause low back pain. So some of us, it's not necessarily due to a major injury. It's actually due to repetitive type motion. We could also call that repetitive trauma, but let's say it's somebody who is standing all day and they're, moving around with their job that way. Or let's say it's somebody who's been sitting for a long time at a desk job. Or let's say it's somebody who is doing a lot of manual labor where they're lifting and twisting and bending. And there are many different professions that do these different kinds of motions. Even as chiropractors, we're stooping literally over patients. So we really have to make sure that our ergonomics are in, our proper way of movement is in when we do an adjustment. So it's very key. Same with any job. So one of the things, a lot of Americans have jobs where you sit, right? It's all about our computers now, our phones, our iPads. So if you're sitting, you want to make sure every 30 minutes to an hour and a half, 2 hours, you're getting up and walking around. When it comes to low back pain, the best thing is to hydrate the discs, because your discs are the little cushions that are in between each vertebra and they need to be moved. And so when you get up to go make a copy or get up to go have a meeting, when you're going to sit again, make sure you do high knee marching if you've got low back pain, because that'll help your discs hydrate. The other thing is, a lot of times our hip flexors get tight, our glutes get tight. So doing piriformis stretches, we actually have some videos on our YouTube channel. It's under Voitenko Wellness, and you can see us doing piriformis stretches, hip flexor stretches, very key to low back discomfort. Cat-cow. That's a very basic type of stretching even that hydrates. But the easiest thing to do is if you're at work and you've got low back pain is high knee marching. Now this even goes for someone who's been standing all day and you're going to take a break. Yes, I know you want to sit, so you can stretch out your piriformis, which is a crossover with one leg and then pulling forward towards your knee, keeping your back very straight. We'll stretch out those glutes on each side. You do each leg. The hip flexor stretches are good too, but even when you're on a break, to high knee march, because you're not necessarily doing that when you're standing at your job. Also really learning how to lift if you have a physical job, making sure you use your legs, you bend correctly, you hold the item as close to you as possible. This is very important for moms with infants and babies or young children. You scoop up your child, you want to make sure you really use your core, your legs to help hoist them up using your core, bringing the child as close as possible. When they're little, they're wiggly. Those are some other tips. Exercise-wise for low back pain, especially if it's a chronic situation, you want to make sure you're doing swimming, biking, things like that to help protect your spine, your low back. Your low back nervous system controls your hips, knees, ankles, feet, as far as the mechanics. So keeping a good, strong core, which has to do with your low back and abs. So making sure you're doing exercises that create a strong low back. But also you want to make sure that you're strengthening your legs to hold you up, because when your low back is not doing well and you have osteoarthritis or degenerative disc disease, or you have disc bulging, disc herniation in the low back, you really want to protect that. So there's exercises and stretches that we can show you at the clinic. Of course, to stop and slow those conditions, chiropractic is amazing. That's what we do. That's our best. That's what we're best at, getting you out of pain, getting the strength you need so you don't have to keep running into this problem. And the problems that occur with it, because along with the low back controlling your lower legs, extremities, it also controls your bowel, bladder, reproductive organs. So if you really want to keep that area doing well, functioning well with the nervous system, you have to make sure that you get your chiropractic care. So we can help with that. We do flexion distraction, we do chiropractic adjustments, we have different frequency machines that we can use to help strengthen and decrease pain. So reach out to us. You know how to get a hold of us, obviously here on Facebook. You can instant message us on Instagram. You can find us on YouTube. You can call us at 714-730-2225. And again, we're always doing our Friends and Family for 40, which is a consultation exam, as well as a chiropractic experience that you can pass on to friends, family, coworkers that might be experiencing low back pain. and symptoms that go along with it. So anyway, hope this helps. Happy Wednesday. Bye.